Okay, usually the complications which happen due to osteotomy during implant placement will be if you're going to perforate the lingual plate in the lower anterior mandible, there may be ecchymosis or hematoma formation may occur if you have perforated the lingual plate. So this happens when you perforate the lingual plate in the floor of the mouth. There is anastomosis of lingual artery. When these capillary arteries bleed, there may be ecchymosis or hematoma formation may occur. This has to be avoided. So your osteotomy should be from the lingual aspect of the ridge angulated towards the labial aspect. So don't start from buccal aspect to lingual aspect. So in that way you can avoid the perforation in the floor of the mouth. And another complication which may occur when placing the implant in the nasal floor, in the nasal spine area, is there may be, when I'm placing the implant of 23-26 mm, so when you are going to perforate the nasal floor, there are chances that so there will be tinge of blood or bleeding from the nostrils, maybe left or right nostrils. So that can be these complications can be avoided if you can place the implant in a proper direction. That is, the osteotomy should be good, the angulated osteotomy should be good. So one more complications is when you're placing the implant in the lower posterior mandible, there are two important areas, that is how the mandibular canal runs, and the second one is where is the mental foramen. So usually the mandibular canal runs towards the lingual aspect in the third and second molar area, and it runs towards the buccal aspect in the first molar and the second premolar area. So while doing the osteotomy, so you have to be careful. So you have to measure properly the length, which length implant you are going to place. The length should be from the crest till the superior border of the mandibular canal. Okay, so 2 mm usually short of the superior border of the mandibular canal. That should be the length of your implant. In the mental foramen area also 2 mm short. Your implant length should be 2 mm short of the mental foramen. So this is the area. So if you can thoroughly anatomically gauge everything, you can place the implant properly in the lower posterior mandible also. In the maxillary molar area, when the ridge length is less, means the distance from the crest till the floor of the maxillary sinus is less, you avoid that area and place the implant in the anterior border and posterior border of the maxillary sinus. In the anterior border of the maxillary sinus, you can easily place some 23 or 25 mm angulated towards the midline. So you can give the angulation of 30 to 45 degrees. So during the osteotomy, in the posterior border of the maxillary sinus, you can place the implant in the through the tuberosity. You can place the implant into the bone between the medial and the lateral pterygoid. There are different methods in that. So in such way, carefully you can manage all these things. So if you have the thorough knowledge of anatomical structures in the maxilla and mandible, you can place the implant easily and you can get the good stability also. Coming to management of hematoma in the floor of the mouth, so if there is a ecchymosis, usually it will subside by itself down the line, maybe for 1 or 2 days. If there is a hematoma, if the small hematoma, even the small hematoma also will also subside by itself. If there is a hematoma size is big, there may be, you need a surgical intervention to drain out the blood. So main thing, when there is an hematoma in the floor of the mouth, the airway should not be obstructed for the patient. You should clear all the blood, and proper airway should be maintained for the patients. So surgical intervention if needed, or otherwise a digital pressure will do, and you have to give there's a cold pack, or otherwise if needed anti-inflammatory drugs, steroid should be given. So in such way you can manage complications. In the upper nasal spine, when there is a placement of implant perforating the nasal floor, you can give the pack of cotton into the nostrils, place it for 3 to 4 minutes. It will usually subside, and the bleeding will stop. So these are all the the main complications which may happen while placing the implant. So that can be managed well, and also you should have the thorough knowledge of the anatomical structures in the maxilla and mandible to avoid all these complications. Thank you.